Madam President, thank you very much for those kind words of introduction. Good evening, ladies and gentlemen. Members of the Board of Trustees of the Sri Lanka Medical Association, honorary fellows of the association, past presidents of the association, council members of the association, members of the association, distinguished invitees, ladies and gentlemen. My mind goes back to the year 1998, when, as a first year member of the Council of the Sri Lanka Medical Association, I was seated in the second row there of this auditorium and listening to the first E.M. Wijerama Endowment lecture delivered by none other than the late C.G. Uragoda, the great medical historian, talking about how he went about developing the specialty of respiratory medicine in this country. It was an inspiring lecture to listen to. I can still close my eyes and visualize some of the slides I was seeing here on this same canopy, as it were. So I'm mindful that I'm following in the footsteps of great men and women who have delivered the E.M. Wijerama Endowment lecture, which last year was elevated to that of an oration by the Council. We are gathered here today to remember the greatest benefactor of the medical profession in Sri Lanka, Edmund Madonsa Wijerama. E.M. Wijerama was born in 1896 in Koskoda. His father was an Ayurvedic physician. He went to school at Rajapaksha College in his village and thereafter came to Royal College in Colombo. From Royal College, he entered the Ceylon Medical College and graduated with LMS in 1922. From there, he proceeded to the UK and read for his MBBS degree at the University College London. He graduated with MBBS in the year 1929, and the next year he obtained a diploma in tropical medicine and hygiene. A couple of years later, he was the recipient of a Doctor of Medicine as well. Later on, he went on to become a member of the Royal College of Physicians and a fellow. Upon return to Sri Lanka, in the year 1935, he became the medical registrar at the Colombo General Hospital, the premier hospital in the country. A couple of years later, he was appointed pathologist, and from there, he went on to be appointed consulting physician and the chief physician at the hospital, a position that he held until his retirement. During his time at the Colombo General Hospital, he also was a lecturer at the Ceylon Medical College, which is now the Faculty of Medicine of the University of Colombo. He was respected and regarded by his students as well as his colleagues, most of whom who went on to follow in his footsteps, giving leadership to the medical profession. They followed in the example of Dr. E.M. Wijerama, who himself was a great medical leader. He was the president of the Ceylon branch of the British Medical Association, as the Sri Lanka Medical Association was known at that time, from the year 1947 to 1948. He went on to become the founder president of the Ceylon College of Physicians in 1967. Along the way, for a period of 5 years, he was also the president of the Ceylon Medical Council, which is now the Sri Lanka Medical Council. One could say that he held the most important leadership positions of it, all the most important leadership positions of his time. In his last year with us, in the year 1980, he was honored with a Doctor of Science honoris causa by the University of Jaffna. He passed away in the year 1980 in December. But his memory lives on with us because of the greatest gift that he made to the medical profession while still alive. In the year 1964, he gifted this magnificent mansion in which he lived to the medical fraternity of this country. The grateful citizens of this country honored him by naming the road in front of this house Wijerama Mawatha. The first time ever that a road in this country has been named after a person who was still alive. Later on, we went on to name this mansion the Wijerama House to honor him and to perpetuate his memory. And when the foundation sessions were instituted in the 1990s, during 1998, in the year of the presidency of Dr. D.N. Athukorala, on a proposal made by him, the E.M. Wijerama Endowment Lecture was established. So, ladies and gentlemen, it's a humbling feeling for me to be delivering this oration in the memory of this great giant in the field of medicine in our country, a man like no other, who led the profession with example and then, of course, gifted it the biggest gift that an individual has gifted, as far as any of us know. This evening, I chose the topic of from Wijerama House to Marlborough House the story of creating capacity for data-driven healthcare in Sri Lanka and beyond as the title of the oration, because I wanted to relate to you what a inspiring organization that the Sri Lanka Medical Association can be. I have been one of the people who have benefited from the association with this organization. The association with the organization and the great men and women who have led this organization. I've been inspired by all of them. Some of them are listening to it here, some of the past president, and some of them I know have joined us virtually. Thank you very much to all those who reached out to me this morning with calls and SMSs and emails, wishing me all the very best for the oration today. When we talk of data-driven healthcare, our mind immediately goes to words like medical informatics, health informatics, eHealth, and digital health. You will be amazed to know when I say that in the year 1997, the first council meeting that was held on the 3rd of January of that year resolved to appoint a medical informatics subcommittee for the association. This was the composition of that committee, and I'm sure you would see and remember some of those names. There were not only medical people, but also others from the IT profession there. The committee later on met at that magnificent old council room today, which we have named as the meeting room of the association. And we dealt with challenges facing medical informatics at that time. Lack of infrastructure, incomplete and inaccurate data and information, the fact that legal and data security issues have not been addressed, the lack of finances, and with all those issues related to sustainability of what we were professing. The deliberations that we made are captured in the MedInfo e-newsletter that we started publishing. And even up to today, you can access what we did on that URL. It's a historic record of what the association was doing way beyond the time the world was actually really trying to talk of data-driven healthcare. A couple of years later, it led to the formation of the Health Informatics Society of Sri Lanka in this very hall that we are meeting. We lit the same lamp that we lit today to give light to this endeavor that we were embarking on. Professor Sham Fernando was the founder president. I had the honor of being the founder secretary. Professor Tissa Visarana participated as the advisor to the president of Sri Lanka on science and technology and the chief guest in the occasion. Covered by the lamp is Professor MTM Jeffrey. And the two other gentlemen who lit the lamp that day, one is seated in front of me, Dr. V.J.C. Pereira, and the other joining online, I'm sure, is Professor Rizvi Sharif. That was the composition on this very hall 20 odd years ago, nearly 25 years ago. We kept on addressing these challenges. Along the way, the World Health Organization came up with a resolution in 2005, but nothing really happened on the ground to address these challenges. We realized around that time that the greatest challenge was that there was lack of capacity and leadership to take things forward. And we were dwelling on how we could do this, how we could really create the specialists needed to take things forward. Along the way, the opportunity came in the way of a chanced introduction to this team, the Health Informatics team at the University of Oslo. I received an email from Professor Rohan Jayasuriya in Australia, who I had never met at that time, introducing me to Professor Sandeep Sahay of that team. Professor Sahay reached out to me and said, we, as the University of Oslo's informatics team, have been working around the world, especially in Africa, developing capacity for public health informatics. And we'd like to come to Asia, and we've looked at the countries and we think Sri Lanka is the best place for it. Would you like to collaborate with us? And I said, by all means. Later on, I was introduced to Jon Bra, the leader of that team, and Christine Barr, the other member of the main team there. And together, we started working. I took the idea with Professor Sandeep Sahay to Professor Rizvi Sharif, who by then had become the president of the Health Informatics Society of Sri Lanka and the director of the PGIM. To make a long story short, I would like to say he opened all the locked doors which would have made this project a non-viable project. He took the leadership decisions which were outside of the comfort zone that Indika was talking about to make this happen. And we are talking about, or I am delivering this oration today because of the unlocking that he did to make what we were going to do happen. We wanted to develop capacity and build leadership for eHealth. Our vision was to produce a generation of leaders in biomedical and health informatics in Sri Lanka with expertise in both the health domain and the ICT domain, who would spearhead the development of eHealth in the healthcare services, working with and under the guidance of administrators and policymakers at the highest level. To do that, we developed a program in biomedical informatics, which was later expanded to a MD program in health informatics, with leading to board certification in the field of health informatics. You would say this is visionary because we were the first country in the world to actually think of board certification for doctors in health informatics. Even the USA came along the way later in 2011. UK does not even have a program like that. So that is how pioneering we were in what we embarked on. We created a specialty board in biomedical informatics at the PGIM. We had HISL, the Health Informatics Society, as our collaborators. We have the University of Oslo as a strong collaborator, and by this time we had got $1 million grant to support our program as a joint effort with the university from NORAD. That made it possible for us to go global and really deliver a globally accepted program. We collaborated with the Ministry of Health, and the Ministry of Health approved sending medical officers to enter the MSc program. They completed the MSc and went back to the ministry and became medical officers in medical informatics. Thereafter, when we started the MD program, they started coming back to us to read for the MD and then go on to become board certified by health informaticians. The challenge that we faced in the year 2008 when we embarked on this was the fact that there was no eHealth infrastructure in the country for us to train our students. Therefore, we need to have a strong focus on innovation. We characterize the innovation that we were embarking on as frugal innovation. Low cost, highly effective, scalable, and sustainable innovation. And by that we meant that we would innovate on open source platforms, using open standards, meeting local needs, and ensure that the solutions were custom built and interoperable, and they were eventually Ministry of Health owned and maintained. We believe that eHealth solutions should be built by health professionals in partnership with the ICT community. Biomedical and health informaticians should lead the process because eHealth is a tool that should be used where appropriate. The aim was health of the population, not eHealth. As we were embarking on this strategy, the framework for eHealth implementation in the country also started taking place. We worked with the Ministry of Health to establish a National eHealth Steering Committee in June 2010. And with it, the frameworks started developing. Sri Lanka's eHealth ecosystem, based on the concept of frugal innovation, started taking shape. Today, there are many solutions out there which are driving this ecosystem. Some of them are obviously seen, some of them are not, but things are moving in this country. I would like to showcase to you two of those innovations that have had a transformational effect. The first one is the eIMMR system, the Electronic Indoor Morbidity and Mortality System. In 2009, two of our colleagues, two of our graduates from the first batch of students came and met me as they were embarking on their projects. Nadish Karyavasam and Buddhika Dayaratna. Buddhika Dayaratna, I think, is the only doctor in Sri Lanka who has visited all the hospitals in the country. And you will see why in a few minutes. They came and told me, sir, this is 2009, but the document or the booklet that everybody looks at to make policy decisions in the country, the annual health bulletin, the latest one that we have in 2009 is for 2002 or 3. the one on the slide. And that we can basically transform this. The data is coming on an indoor morbidity and mortality reporting system. The data captured can be reduced to one data entry screen and with it deployed. I asked them how much it costs, and they gave me a budget of about 53,000 rupees, $250, and with it we had a system. This is the timelines of that system. By the year 2012, the system was adopted countrywide. So from 2010, when we started with record rooms like this, by the year 2018, we had dashboards. The system was, now, as it is now, implemented in 89% of hospitals in the line ministry, count for 92% of discharges. There are more than 1,800 users of this system, and there are a total of more than 56 million data elements in this. The largest repository of data, health data in this country, which enable us to look at trends in morbidity, trends in mortality, trends in hospital utilization, and so on and so forth. Real-time data at the top of a fingertip with the printed version very fast behind. You would agree, transformational changes. Today, if you want any data, whenever I want any data, I just go to the medical statistics unit, and within a matter of hours, I would get an entire data set of what I want to look at. That's the transformational change. We could never have done that in the past. Moving on to another innovation, the district nutrition monitoring system. In the year 2014, the Presidential Task Force on Multi-Sector Task Force on Nutrition was established, and we were invited to develop the informatics backbone, as it were, to operationalize the multi-sector action plan. I came back to the board and said we have to do it as an MSc project, and the board agreed. And one of our students, Pramod Amarakon, took off on the task. He developed an app using the DHS to open source backbone with its all dashboards. To cut a long story short, immediately within a few months, we had midwives in the field using smartphones and collecting data. And this is very early data from the year 2016 or 17, where we had thousands of midwives using this system. Today, I understand that it is getting integrated to another bigger system in a different way. We had trilingual capability. We had the capability to map or monitor what was going on in the field using dashboards. Using GIS maps, you could go down to the individual household and see what was happening and where the children were. That was the capability that was built. And this system became the most decorated system that our students have developed. In the year 2016, it won the World Summit Award as the best app in the health and wellness category from innovations from 178 countries. That is the capability that we have in this country. We were able to unleash through the program. All this is now history and documented. As this was happening, the Sri Lanka Medical Association was embarking on another phase, going to the Commonwealth. And that happened at a meeting with the health minister at that time, with the president of the Commonwealth Medical Association, Dr. Suleiman Juman of Trinidad and Tobago, and Dr. Sundaram Aluraj of India, a past president, and myself with the Minister of Health, where we discussed Sri Lanka Medical Association's ambitions of taking the leadership in the Commonwealth Medical Association. With it, we began the phase in Marlborough House. We articulated our vision and mission for the Commonwealth Digital Health Initiative, which became the flagship project of Sri Lanka's presidency in the Commonwealth Medical Association. We took our ideas to the Commonwealth Advisory Committee, and the Advisory Committee accepted our ideas. Dr. Jonas, the health advisor to the Commonwealth, immediately saw the value proposition that we were bringing and supported us. They agreed to come to Colombo when Sri Lanka was assuming the presidency of the Commonwealth Medical Association. First time ever, the Commonwealth Advisory Committee on Health had met outside of London. They met with us, and on the sidelines of the Commonwealth 24th Triennial Meeting of the Commonwealth Medical Association, the Commonwealth Advisory Committee, as well as other partners, developed the Commonwealth Colombo Declaration of the Commonwealth, as well as a plan for collaborative action. We took the declaration and the plan for collaborative action to the Commonwealth Marlborough House once again. I was greeted by the Secretary General of the Commonwealth at that time, and we worked together with the Commonwealth Advisory Committee on Health and came up with a policy brief on digital systems for One Health. We had the backing of the Sri Lanka government at the highest level. And that backing continued, and that was pivotal to what we were doing. To operationalize what was envisaged in the policy brief, the next year, in the year 2018, when the Commonwealth heads of governments had their meeting in London, we launched the Commonwealth Centre for Digital Health. At the meeting, at the event, was the President of Sri Lanka and the Deputy Prime Minister of Malta. It was a significant presence because at that time Malta was the chair in office of the Commonwealth. So we had the backing of the chair in office of the Commonwealth for what we were doing. So Chris Fernie, who is the Deputy Prime Minister of Malta, was our keynote speaker there. With this endorsement, we went further. We went and established the Commonwealth Centre for Digital Health's hub for universal health systems at the University of Southampton in the year 2019. This time, we from the University of Colombo were also collaborating with that. This was the event where we met. We had the Dean of the Southampton Medical School joining us. By that time, Dr. Joanna Nurse had become a visiting professor at the University of Southampton. She gave us the fullest support. We had the support of the Professor of Clinical Informatics at University of Southampton, who hosted the hub in his department, Professor James Batchelor. And then, of course, the tower of strength to all the work that we do in the Commonwealth is Mr. Anup Singh, who's our Chief Operating Officer. And we also had Professor Dr. Pandula Siribadana, our very own, who does a lot of work with the Commonwealth, leading our innovation arm, as it were, also there. And we had all international partners engaging us, including the World Health Organization, which was represented by its head of digital health. Today, the hub that we have at Southampton is the hub where our biomedical and health informaticians go to have their foreign exposure, plus give leadership to activities of the Commonwealth Center for Digital Health. We designate them as Commonwealth Digital Health Fellows. Among the things that they do is one of the key activities, an activity which involves producing a digital platform for the planet, place, and people, where we are cataloging all digital solutions that are out there in the world on the Commonwealth Systems Framework for Healthy Policy, a policy that has been adopted by the Commonwealth Health Ministers. And with this tool, we are able to now go forward and recommend to health systems and governments what tools that they should be using to strengthen their digital health ecosystems in their countries. We are, as a group, strong on advocacy. Annually, we meet on the sidelines of the World Health Assembly in Geneva and advocate for future world action. So in 2018, when the World Health Assembly resolution on digital health was adopted, we had the most influential side event there with India's Prime Health Minister taking leadership and the keynote speaker. The next year, when the World Health Organization appointed its first Chief Scientific Officer, she was our keynote speaker at our side event, advocacy event in Geneva. The same year, we had the largest digital health series of conferences in Colombo, bringing together not only the Commonwealth, but all the other partners, the International Medical Informatics Association, the Asia Pacific for Medical Informatics, and then, of course, the Asia eHealth Information Network, as well as lots of other partners. All the regions of the Commonwealth were represented and beyond. In the year 2020, as the pandemic broke, we were able to bring together all the Commonwealth partners, the Commonwealth Health Professions and Partners Alliance, which I currently chair, was in 2020 taking leadership in bringing together all partners to put together a policy brief that we took to the Commonwealth Health Ministers' virtual meeting that year, where we highlighted to them the opportunities in the use of digital technologies in healthcare and the benefits that it brings. We were successful in getting a line into their declaration. As you know, at international level, getting something onto a ministerial statement takes time and effort. But what we were professing in 2020 became a reality the year after, when the health ministers decided to open an entire technical working group dedicated to the response to COVID, with digital health as one of the main work streams. And just a few weeks ago, we had the first meeting of that work stream, and we, as the Commonwealth Center for Digital Health, together with the World Health Organization, are the technical advisors to this work stream. So we play a very pivotal role now in advocacy, and Sri Lanka and the capacity that we have developed through our biomedical and health informatics program is playing a leading role in this advocacy activities. Moving on to innovation. Frugal innovation continues to be our theme. As the pandemic broke, some of our graduates came and had a discussion. They said, we need to really now start focusing on surveillance and monitoring. They decided to customize the DHIS2 open source platform for COVID surveillance. The design that was made by our graduates, together with colleagues in the Ministry of Health of Sri Lanka, is now global. It's gone to more than 50 countries. In fact, the DHIS2 system has its origins in the University of Oslo, and it was not really used in Norway as a national system. And taking on from this, they have now adopted it as a national system there. And the Prime Minister of Norway last year at the UN General Assembly had this to say about the origins of that system. So therefore, ladies and gentlemen, we have the capacity to innovate for the world. The second system was the Self-Shield app, which was developed for individual health checking and monitoring, and also to open up monitoring individuals to the system. A few months ago, the Ministry of Health adopted it in their platform. Today, there are more than 50,000 downloads of this system, which is available in the App Store and Google Play. And the vision is to build this system further with a view to empowerment of citizens and shielding the health system of shocks like the pandemic that you can withstand using digital technologies. We are looking at a platform, we are looking at this as a platform technology for the future. And this was recently showcased in BMJ Innovations as well. You would see the importance of these kind of technologies and taking them forward when you look at the transformational effects the 247 system of the Sri Lanka Medical Association had during the past few months. The number of lives saved, the number of people that were served was countless. A simple telehealth solution that traces back its origin to a few years, which was reinvigorated and taken to another level under the leadership of Professor Indika Karunatilaka and the Council of the Sri Lanka Medical Association this year. Something that we can all be proud of as the Sri Lanka Medical Association, as well as the wider medical community in this country. So we need to embrace innovation and go beyond the traditional modes of collaboration to make these happen. We have also been involved in recognizing and rewarding innovation through the work that we do in the Commonwealth. The Commonwealth Digital Health Awards were instituted in the year 2016 for that purpose. This year, we have the 5th edition of the awards, And if anyone is interested, I would like to invite you to go to the website and make your submissions if you have innovations, because till there is time. And why I'm making that invitation is because now we are going further than recognizing innovation to supporting scaling up of innovation. We are going to the next level. And those of you who are in our mailing lists would have seen these initiatives, which are aimed at scaling up innovation, supporting them. So to support that, we are in the process of establishing a center called the Princeton Frugal Innovation Accelerator in Princeton, New Jersey. There again, a lot of leadership given by our biomedical and health informaticians. Today, in a global world which is virtually driven, you don't need to be physically located in a particular location to give the leadership to this kind of endeavors. So, ladies and gentlemen, on the eve of the 25th anniversary of this historic day, in January 3rd, 1997, when the Sri Lanka Medical Association's Council took the decision to establish a medical informatics subcommittee, it's a humbling feeling as someone who was witness to this entire journey to be able to relate to you the story of the past 25 years. I hope that this story would encourage the younger members of the association who are here to embrace the association, to give, to take inspiration from the work that have been done, and also to embrace the association's leadership, the council, and so on, so that they can support you to help and nurture your visions and ambitions. A journey like this, you would realize, is not a one-man's journey. You cannot ever trod a path like this alone. There are few people who needs to be specially mentioned and thanked. Professor Sham Fernando and Professor Rizvi Sharif, they gave key leaderships at the two key points in time, the formation and of course the scaling up to our capacity development. Members of the specialty board in biomedical informatics in the PGIM, all of us work together to ensure that what we did really came to fruition. It was a challenge. It was a real challenge in 2008 when we had the first batch of students and they were selected. The Ministry of Health refused to release them to come to the program. It took a while, nearly 5 to 6 months, to get that approvals. However, by 5 years down the line, when we were introducing the MD program, the value of what we were doing had been realized, and what we were asked was, how many more can you develop? Not a case of limiting numbers. So we had actually brought about that transformational change. My colleagues at the Commonwealth Center for Digital Health, in the picture that I showed you, one of those members were not there, Tony Singaraya, but he has been a tower of strength to us in our innovation work, coming up with all the models for innovation that we have adopted in terms of recognizing awards, and also now trying to scale up frugal innovation through the Princeton Frugal Innovation Accelerator. Colleagues in the Health Informatics Society of Sri Lanka have been there always. There are so many. I'd like to thank them all. Colleagues in the Commonwealth Medical Association, who embraced and supported me when I took over as president, as Sri Lanka's president in the Commonwealth, and supported the idea of a flagship project in digital health and gave the fullest support. Dr. Surendaram Anuraj of India, Dr. Suleiman Juman of Trinidad and Tobago, Dr. J.P. Tabon of Malta, and many others really supported us all the way. Colleagues in the Sri Lanka Medical Association, all the presidents, councils, all these years have been a tower of strength to us. Colleagues in the Commonwealth Health Professions and Partners Alliance, which brings together nurses, midwives, pharmacists, and everybody else working in the health space around the Commonwealth, are with us in these endeavors. Baroness Patricia Scotland, the Secretary General of the Commonwealth, and the health team at the Commonwealth Secretariat have always been supporting our work. The Ministry of Health of Sri Lanka, the current Secretary, Dr. Munasinghe, as well as the former secretaries who supported us. Dr. Ruberu's name come to mind. He was a real tower of strength when we started our work. And the Director Generals of Health Services, the current Director, Dr. Asela Gunawardena, as well as Dr. Palitha Mahipala, who really gave us a lot of support at that time. The Directors of Information, starting from Dr. SRU Vimalaratna, who was really working day and night with us to make this happen. Then moving on to Dr. Champika Vikramasinghe, Dr. Indika Jagoda, Dr. Anil Samaranayaka, and now Dr. Palitha Karunapema. All of them have been really proactive and supporting with the work that we do. And of course, all kinds of directors at central, provincial, regional, and other levels, without whose enthusiasm for nurturing the innovation that our graduates were coming up with, we wouldn't have achieved what we've achieved today. Staff of the Ministry of Foreign Affairs and the Sri Lanka Permanent Mission in Geneva, especially Mr. Ravinatha Arya Singha, who was the Sri Lankan ambassador in Geneva during the time that we were doing all of this work in Geneva. Many international development partners who supported us all the way. My colleagues in the Department of Anatomy, my mentor, Professor Rohan Jayasekara, and my colleagues in the department who really give me all the support to take time off to do all this work. And today, as a result of that, we have been able to enhance our department into a department of anatomy, genetics, and biomedical informatics, the full power of which I hope we'll be able to unleash when we move into the new premises next year. I want to go back to the beginning, as it were, also, because I was fortunate enough in school to work with a really inspiring group of friends in school, where we formed what was probably the first ever computer society in a school in Sri Lanka at the Royal College in the year 1982. I'd like to remember them all. Some of them are all over the world doing very, very leadership positions. So that's where all that kind of inspirational pioneering spirit came to me in this ICT space. Of course, when you give an oration like this, it's incumbent on the orator to thank the family as well. So I'd like to thank my wife Ruangi and my kids Senithi and Tilina. Of course, this morning Tilina reminded me this picture is a misrepresentation of the current situation. 3 years ago, he was the shortest in the family. Today, he's the tallest in the family. Unfortunately, we didn't have a updated picture to show you. I would like to also play a tribute to my parents, especially my father. This picture was taken by my daughter this morning. I'm holding my first computer, the Spring-Class Spectrum computer that I got in 1983. One day my father came and said, Puta, a salesman came to my office. He had this thing called a computer. Would you like to go and see this computer in his store? It looked interesting. So we went to this place and saw the computer. He said, would you like to have it? I said, yes. All right. You have to be the first in class if you want to have it. I had never been the first in class before that. So the next term, I became the first in class. Then I asked for the computer. He said, I didn't tell you how many times you have to be the first in class. So I became first in class next term also. And then I got the computer. I would also like to pay a tribute to my colleagues, Dr. Roshan Hevapatirana, who's here, who's been there for us from day one in our program, supporting and nurturing our graduates. Dr. Rohan Amarasinghe, who is also here. He has been a tower of strength to the work that we do in the program. Dr. Pandula Siribadana, who is also here, leading the innovation and taking it global now. Dr. Achala Jatilaka, who has gone to greener pastures, but I'm sure he's also going to help us from where he is in the World Health Organization. Of course, Prof. Jon Bra, Sandeep Sahe, Christine, and their team in Oslo. Their collaboration was pivotal to what we did. Finally, last but not least, all the graduates of the program. When I look at these graduates, there are those who are working globally. There are those who are working at the Centers for Disease Control in Atlanta, in Georgia. In fact, in the Public Health Informatics Fellowship Program at the Centers for Disease Control, Sri Lanka, as a small country, is overrepresented because we get more places there than others. We also have colleagues working in the World Health Organization in various parts of the world and in other countries like Australia and so on. They are all over the place. So we have created a capacity not only for Sri Lanka, not only for the Commonwealth, but for the entire world. That is the strength of this organization, the Sri Lanka Medical Association. With those words, ladies and gentlemen, all that remains for me is to thank you for your patient listening. Thank you very much.